Hello everyone, welcome back to our channel. In today's video, we are going to see an important factor of OET speaking under clinical communication criteria, information gathering. When we talk about information gathering, it is about how you interact with the patient to collect important details about their health. So it's not just about asking the right questions, but also how you show you are really listening, how you ask those questions, and how you get the information you need without missing anything important. Here, there are five key things the assessors are looking for. Let's see them. The first one is active listening, and the next is using open and closed questions, and the third one is avoiding compound or leading questions. The fourth is clarifying unclear statements, and the last one is summarizing information. Now, let's break them down with examples. When it comes to active listening means you are fully engaged with what the patient is saying. It's about showing you are paying attention through both your words and actions. In the OET speaking test, you won't be able to use body language like nodding. But remember, it still counts in real life. Some ways to show active listening in a conversation. Example, you can use simple words or sounds saying things like, mm, I see, go on, or okay. When the patient is talking, you can say these words. This encourages them to continue and shows that you're interested. Example, if the patient is saying, like, I've been feeling more tired lately and it's been hard to concentrate at work, then you can tell, I see. It's tough though when it happens. So, this response shows the patient you're engaged and gives them a space to keep explaining. And you have to reflect or rephrase. You can repeat or rephrase what the patient says to show that you understand and to encourage them to elaborate further. Example, if the patient is telling, like, I've been having back pain for a few weeks now. So you can just, again, you have to reflect or rephrase the same sentence by saying like this. So the pain has been there for a few weeks now. This shows you are actively listening and invites them to clarify or add more. Now, the next one is using open and closed questions. Now, asking the right kind of question is very crucial. Open ended questions, it will let the patient explain more about their situation, while close ended questions are more specific and it help you confirm or narrow down some information. When it comes to open ended questions, these are questions that can't be answered with just a yes or no. This encourages the patient to share more when it comes to open questions. Example, if you're asking, can you tell me more about what's bothering you? So, this opens up the conversation and gives the patient the chance to talk more about their symptoms. Whereas in close ended questions like, have you had any chest pain today? This type of question invites the patient just to tell yes or no answer. So always use open ended questions. However, don't use compound or leading questions. A compound question means it combines two questions into one, which can confuse the patient. And when it comes to leading question, it suggests a specific answer. Example, if you're asking a question like, have you had headaches or dizziness recently? So, this type of question could confuse the patient as they might want to explain both separately, but you are asking two things in one question. And incorrect leading question example, you don't feel much pain now, do you? When you're asking this type of question, it seems like you expect them to say no. So try to avoid these type of questions. And the next one is clarifying unclear statements. Sometimes the patient might say something that's unclear or vague. But it's very important to ask them to clarify so you don't miss any crucial information. Example, if the patient is telling, I've been feeling off for a while, and when you say off, could you explain more? Are you feeling tired or is something else bothering you? By asking for clarification, you are making sure you fully understand what they mean. And the next one is summarizing information. After gathering some details, it's always good practice to summarize what the patient has shared. This gives them a chance to correct anything that might not be accurate or add more information. For example, if you're asking so you have been feeling tight for the past few weeks and also having trouble concentrating at work. Is that right? So this shows the patient you are paying attention and also gives them opportunity to confirm or correct what you have understood. Got it? And the next one is inviting further information. Sometimes patients might leave out important details. By summarizing and asking follow up questions, you encourage them to share more. For example, you mentioned feeling tired. Have you also been experiencing headaches or trouble sleeping? So, this gently invites them to provide additional details that could be important for their diagnosis. So, when communicating with patients, it's very, very important to help them understand the information clearly and try to avoid any type of confusion. And one key aspect of effective communication is clarifying vague statements. Sometimes patients might not explain things in enough detail or they may be unclear about certain points, right? This could be due to various factors such as not knowing how to express their symptoms or they may not remember specific details. When this happens, it's important to ask follow up questions that help them elaborate and provide the missing details. The patient is telling like this, I've been feeling unwell for a while. And you, can you tell me more about what you're feeling? Is it a pain or more of a discomfort? Where exactly do you feel it? Here, the patient has mentioned feeling unwell, but we need to more specifics to understand their condition. By asking about the type and the location of the discomfort, you are helping them express what they might not been very clear about initially. Got it? Here is another example about unclear lifestyle habits. The patient is telling, I don't eat much, just sometimes. Could you clarify what a typical meal looks like for you? How often do you eat during the day? In this case, the patient's statement about their eating habits is very vague, right? You need to understand their nutrition better, so you need to get more details on the frequency or on the type of meals they have. And the third example is about a scenario of uncertain medication compliance. Here, the patient is telling, I take my medication most of the time. And you, can you tell me how often you forget to take it? Is there a particular time you skip the dose? Here, the patient says they take their medication most of the time, but we need to understand whether they are missing doses frequently. So, you need to ask for a specific instance. And the last example here is incomplete medical history scenario. So, if the patient is saying like this, like, I had a surgery some time ago, and you are asking like this, when did the surgery take place? And can you tell me what the procedure for that? Here, the patient has mentioned a past surgery, but hasn't provided details like the timing or nature of the procedure. So, it's your duty to ask for specifics which allows you to gather the full medical history, which is essential for treatment planning, right? So remember, you need to ask for clarification in a very friendly and non judgmental manner, which help patients articulate their thoughts more clearly and ensure you're gathering accurate, complete information. This is not only makes the conversation more productive, but also shows your attentiveness and care. Hope you like this video. Kindly like, share, subscribe for more OET tips. Thank you. See you in the next video. Bye bye.